Welcome to the Deflux for VUR YouTube channel. I'm Carrie Redd, Training and Education Lead for Palate Life Sciences. Today, we're joined by my friend, Hal Scherz. Hal, I'd like to get your comment on why caregivers whose child either has these febrile UTIs or is diagnosed with VUR, why should they see a pediatric urologist?
Well, it's great to be with you again, Carrie. And that's a great question. Children who have urinary tract infections, who have vesicoureteral reflux, are children who typically have problems that affect their urinary tract. It's not just the kidneys. It's not any one thing in particular very often. It's their entire urinary tract at times, or it can be involving their bathroom habits. And the pediatric urologists are a group of people who have had specific training in the problems that children have involving their urinary tract, their function, their anatomy. And this knowledge, this frame of reference that pediatric urologists have is unique to this specialty. There are a number of doctors who may take care of children with these problems. Pediatricians will often continue to see patients who have urinary tract infections and maybe even continue to follow children who have low grade of reflux. Sometimes these children are sent to pediatric nephrologists, whose specialty is actually the kidney and not necessarily anywhere else in the urinary tract. Some of these children may go to see adult urologists for whatever reason. Some places around the country might not have a pediatric urologist, in which case, there's really very little choice. But in places where there is a choice and you have pediatric urologists and general urologists for these types of problems, pediatric urologist is a specialty that's best suited to take care of these problems. And why? Because these are not just a single entity, this problem. It's not monolithic. It's a very varied group of problems that is different in every child. And so you can't necessarily treat two children the same way. It requires an individualized treatment plan that pediatric urologists best understand. And whereas some of these others taking care of children with these problems may undertreat and put the child at risk for more problems, or overtreat, treat with surgery when it might not necessarily be indicated. Pediatric urologists, for the most part, will typically administer the correct treatment, and they will understand what the best way to handle these problems are for children, because this is all they do.
Well, Hal, that's very insightful. And it's really important for families to understand exactly what a specialist brings. And we've had a long symbiotic relationship in working with pediatric urology here at Palate Life Sciences and the people who have the product Deflux. So again, we thank you for being a guest speaker on our Deflux for VUR YouTube channel. And we'll continue to expound on this discussion so that caregivers can find the comfort of knowing exactly what they should do to help take care of the children in their care. So thank you.
Thank you.
Join us again soon.